So again, good morning, everyone, and thank you for the opportunity to be here. I'm very excited to be with you to celebrate our past and look forward to the future of tobacco prevention and control in South Carolina. Again, my name is Sharon Biggers, and I've worked in tobacco control on the local, regional, state, and now the national level for over 30 years, and we are now working across all state and territorial tobacco control programs across the country to increase capacity and access to cessation. I'm so pleased to be able to be here to share some of our history with you. Today, I want us to spend a little bit of time reflecting on where we've been as a tobacco control movement, nationally and here in South Carolina. Barbara asked that I cover 25 years, but since I've been doing it for 30, I'm throwing the extra 5 years in for free. This field has evolved quite dramatically over this time period. What started largely as public education and awareness campaigns grew into one of the most successful public health movements recognized today. So why does this story matter? When we talk about tobacco control history, we're really talking about culture change. Over the last 30 years, smoking shifted from something deeply normalized in American life to something many young people today can barely imagine being allowed in hospitals, in offices, in airplanes. But the story is bigger than changing social norms. Tobacco use remains the leading preventable cause of death in the United States and in our state. And the last 3 decades transformed tobacco control from scattered education efforts into coordinated public health action focused on policy, healthcare systems, prevention, cessation, and community partnerships. South Carolina has played an important role in that progress through smoke-free policy efforts, coalition building, and growing healthcare engagement. And while we've made tremendous progress, the work is far from over. The next chapter will require new approaches to nicotine products, stronger healthcare integration, and continued adaptation to evolving public health landscapes. So today is not only about celebrating how far we've come, it's also about helping shape South Carolina's future in tobacco prevention and control. So if you were around in the early 1990s, the tobacco environment looked completely different than it does today. Smoking was everywhere, as Ashley mentioned. Restaurants had smoking sections, people smoked in offices, airplanes still allowed smoking into the early 1990s. Cigarette vending machines were common. Tobacco advertising was deeply embedded in American culture. Sports sponsorships, magazine ads, convenience stores, billboards. And while we understood smoking was harmful, the public conversation around secondhand smoke was still developing. For younger audiences today, some of these images feel unreal. That's important because it reminds us just how much culture change has occurred in one generation. The 1990s were a major turning point in tobacco control when science, policy, and public awareness began aligning in powerful ways. In 1992, the EPA classified secondhand smoke as a known carcinogen, shifting the conversation from personal choice to public health protection. Then in 1994, the famous tobacco executives testified in front of Congress that nicotine was not addictive. It was a moment that intensified public distrust of the tobacco industry. In 1996, the FDA began asserting authority over tobacco products, particularly around youth access and marketing, signaling a growing push for regulation. Then came the 1998 Master Settlement Agreement. Who remembers the Master Settlement Agreement? When restricting tobacco marketing, and it helped states build long-term tobacco control infrastructure. South Carolina began receiving and continues to receive millions of dollars annually through this settlement, though none of it is now dedicated to tobacco prevention and control. Towards the end of the decade, CDC released its best practices framework, helping define what comprehensive tobacco control should look like, including coalitions, media campaigns, quit lines, policy change, and surveillance. Together, these milestones laid the foundation for modern tobacco control: stronger science, stronger policy, and coordinated systems-level prevention and cessation efforts. So what did things look like in South Carolina at that time? Efforts were very local coalition focused back then. We had about 15 local tobacco coalitions statewide. We were operating under what was then known as Project Assist, which was the precursor to the CDC Office on Smoking and Health's National Tobacco Control Framework. Many of these partnerships, including work with the American Cancer Society and the National Cancer Institute that funded Project Assist, laid the groundwork for advancing tobacco control in our state. So let's take a look at our data. During this time, we had a major focus on cigarette smoking. We didn't have to worry too much about all of the other products. Just to give you a snapshot of what smoking rates looked like at the time, adults were close to 30% in their smoking rate, close to 30%. And our youth was as high as 33%. I remember that figure very, very clearly when I started in tobacco control in 1994. 33% was our youth smoking rate. So a lot of work has been done since then. The 2000s marked a major shift in tobacco control, from individual education campaigns to broader systems-level approaches focused on prevention, cessation, healthcare integration, smoke-free air, and policy change. In South Carolina, this era included the creation of the South Carolina Tobacco Collaborative on September 11th, 2001, oddly enough, which was the precursor to Smoke-Free South Carolina, who are our hosts today. And it also saw the launch of the South Carolina Tobacco Quit Line in 2006. And I'm thrilled that Katie is going to be talking about that a little bit later, the decades of tremendous work that's been done there. Around the same time, the national 1-800-QUIT-NOW portal phone number expanded access to counseling, nicotine replacement therapy, and cessation support nationwide. Youth prevention efforts also became more targeted and evidence-based. The Rage Against the Haze youth movement empowered hundreds of youth in South Carolina to become visible smoke-free advocates in their schools and communities. Had to get that plug in for Rage Against the Haze. We bled for that one. Another major turning point came with the 2006 Surgeon General's report on secondhand smoke, which concluded that there is no safe level of exposure. In South Carolina, later court decisions, including from the state Supreme Court, affirmed that local communities could enact their own smoke-free ordinances, helping expand protections across the state. Healthcare systems also became increasingly engaged in tobacco treatment through screenings, referral, and cessation support integrated into routine care. Together, these efforts reflected the rise of comprehensive tobacco control strategies that combine policy, healthcare, prevention, media, and cessation services to create lasting population-level change. Now, it's really fun to encapsulate these accomplishments over this time into one slide, but let me tell you, this represented incredibly hard work, hard conversations, and wholesale changes in the way that we moved tobacco control forward. And a lot of y'all were in on those conversations too, and you can verify that it was not always easy. Moving to 2009, the Family Smoking Prevention and Tobacco Control Act marked one of the most significant tobacco control actions to date. For the first time, the law gave the FDA authority to regulate the manufacturing, marketing, and distribution of tobacco products. This was a major turning point because tobacco products had previously operated with far less federal oversight than many other consumer products. The act also focused heavily on reducing youth exposure to tobacco marketing. It restricted youth-oriented advertising tactics, limited flavored cigarettes that appealed to younger audiences, and placed new rules on how tobacco products could be promoted. Another important component was stronger health warnings and product oversight. The law required more visible and graphic warning labels and gave the FDA the ability to review ingredients, product claims, and new tobacco products that were entering the market. However, the graphic warning labels are still in litigation 17 years later. Overall, this legislation represented a major shift from simply educating the public about the dangers of tobacco to actively regulating the tobacco industry at the federal level. I love talking about this one. For many years, South Carolina had the lowest cigarette tax in the country, and raising it became one of the state's longest-running tobacco control policy efforts. Public health advocates, healthcare organizations, and community partners spent nearly a decade educating policymakers and the public about the health and economic impact of tobacco use and the importance of increasing the cigarette tax as both a prevention and a revenue strategy. After 10 years of advocacy and legislative efforts, South Carolina successfully passed a cigarette tax increase in 2010. The tax increased from just 7 cents per pack to 57 cents per pack, a historic change for our state. This was significant not only because higher prices are proven to reduce smoking, especially among youth, but it also represented a major shift in South Carolina's approach to tobacco control policy. Importantly, the legislation also dedicated a portion of the revenue, $5 million annually, to the South Carolina Department of Public Health to support essential tobacco prevention and cessation programs. And many of the organizations that you work with have benefited from these funds. We've been able to really share those funds out and get this money throughout the state. The funds help strengthen statewide efforts in education, quit support, community programs, and broader public health initiatives aimed at reducing tobacco-related disease and death across South Carolina. So just to take a look at a current map, this is a current map. At the time, we moved out of the #1 lowest taxed in the country position. So we were the #1 lowest when we were at 7 cents, and now Missouri gets that benefit. But as you can see, as time has passed, we're back down into the lowest tax group again. If you look at all of the brown states, we are back along with our southeastern neighbors in the bracket of the lowest tax across the country. The average tax on the pack is $2.05. So we're still at 57 cents, but at least we're not the lowest. So I used to go to CDC and they'd put the map up like this, and there was South Carolina and I was like, oh no, don't make me do this again. So I was really happy when Missouri got into the lowest slot. I worked really closely with their program manager, and we used to commiserate together. So I was like, it's yours now, Stan, have fun. Yes, that's right. That's right. We certainly do. Certainly do. One of the most significant shifts in tobacco control over the last decade has been the rapid rise of electronic cigarettes and vaping products. What began as a relatively small market quickly became a major public health concern, particularly among youth. By the late 2010s, youth e-cigarette use had surged, driven by the flavored products, social media marketing, and devices that were easy to conceal. This created an entirely new landscape for public health. Unlike traditional combustible tobacco products, vaping introduced new questions about nicotine addiction, long-term health effects, youth appeal, product regulation, and cessation that we are still working to fully understand today. In 2019, these concerns intensified with the EVALI outbreak, the e-cigarette or vaping product use associated lung injury, which hospitalized thousands of people nationwide and resulted in dozens of deaths, including one death in the state of South Carolina. Investigations later identified vitamin E acetate, an additive commonly found in some THC-containing vaping products, as a primary cause of the lung injury. The outbreak highlighted how quickly new products and additives can emerge ahead of research and regulation, creating major challenges for public health response and consumer safety. At the same time, vaping sparked ongoing and often complex discussions around harm reduction. Many public health and clinical experts view e-cigarettes as potentially less harmful than combustible products and as a possible pathway for adult smokers to transition away from smoking. Others have raised concerns about youth initiation, long-term nicotine addiction, dual use, and the potential to undermine decades of progress in tobacco prevention. These conversations continue today and reflect the complexity of balancing prevention, cessation, and risk reduction in a rapidly evolving environment. The rapid evolution of vaping products has also created challenges for surveillance, education, cessation approaches, and policy development. New devices, disposable products, synthetic nicotine products, and changing marketing strategies often emerge faster than research and regulation can keep pace. Overall, the rise of vaping products marked a new and far more complex era in tobacco control. Media campaigns have become one of the most influential tools in tobacco control, helping shift public perception, reduce tobacco initiation, and increase quit attempts. A major milestone was CDC's Tips from Former Smokers campaign, which launched in 2012. By sharing real stories of people living with smoking-related disease, the campaign used powerful, emotional storytelling to encourage quitting and increase awareness of tobacco's health impacts. The Family Smoking Prevention and Tobacco Control Act also helped pave the way for national youth prevention efforts like the FDA's Real Cost campaign, which launched in 2014. The campaign focused on preventing youth tobacco use through hard-hitting messages about addiction, loss of control, and other immediate consequences of nicotine use. In South Carolina, youth prevention and cessation messaging has expanded through statewide media partnerships and targeted campaigns, such as Down and Dirty, Behind the Haze, and Quit the Hit. These efforts have used modern, digital-first strategies to increase awareness of vaping risks, strengthen prevention messaging, and support cessation among youth and young adults. Together, these campaigns reflect the evolution of tobacco control messaging, from broad awareness campaigns to emotionally compelling and highly targeted communication strategies designed for today's rapidly changing nicotine landscape. Over the past 30 years, tobacco cessation has shifted from individual counseling approaches to health systems change and population health strategies that embed treatment into routine care. A major evolution has been the integration of tobacco treatment into clinical workflows and electronic health records, including automated prompts and opt-out referral systems that connect patients directly to cessation services like quit lines and embedded programs. This helps make tobacco treatment a standard part of care rather than an optional step. There's also been significant progress in insurance coverage for cessation counseling and medications, reducing financial barriers and improving access across populations. There's also been significant progress with tobacco treatment being integrated into behavioral health and chronic disease care. Recognizing tobacco use is a key factor in conditions like cardiovascular disease, COPD, and mental health treatment. Taken together, these shifts reflect a move towards systems-level sustainability, where cessation support is built into how care is delivered and funded, not dependent on individual providers alone. Now, I do work in this space at the national level. I support efforts to strengthen these systems and expand access to evidence-based tobacco treatment across all the state and territorial tobacco control programs. So I'm continuing to see this evolve and grow across the country, and always hope to be able to bring any lessons learned from that experience to our state as well. In South Carolina, tobacco control progress has increasingly been driven by cross-sector collaboration across public health, hospitals, health systems, and nonprofit partners, creating a more coordinated approach to prevention and cessation. A major milestone in this arena was the expansion of South Carolina's Medicaid cessation benefits in 2018, which has helped improve access to counseling and FDA-approved medications for individuals who rely on public coverage. This policy shift has been critical in reducing financial barriers to quitting and increasing access to services. And I will say, from my position at NACDD, we are actually conducting 2 learning collaboratives with our state and territorial tobacco control programs. We've got 18 states in our insurance coverage cohort, and we are still using the lessons that we learned in South Carolina from our effort here and with 618 as an example, as a high-level model of how to do it and how it can work. So very, very proud of that. At the clinical level, there's also been growth in cessation referrals and provider engagement, with more health systems integrating tobacco use screening and referral processes into routine care workflows. This includes stronger use of electronic referral pathways that connect patients directly to quit services. And I know that Katie is going to cover this very, very thoroughly in her presentation of the decades of great work in this area, and it's always a huge win for South Carolina when you talk about this. Community and statewide initiatives like the South Carolina Can't Quit initiative and the Tobacco-Free Recovery further strengthen the ecosystem by supporting quitting in both clinical and community settings, including for populations with cancer diagnoses, behavioral health needs, and substance use recovery. Early successes in smoke-free policy adoption in these settings has helped bolster this initiative. Over the past 30 years, the tobacco industry has continually adapted its products and marketing strategies in response to policy, public awareness, and changing consumer behavior. As cigarette use declined, the industry shifted towards new products, new messages, and new audiences. We've seen the rise of products like flavored cigars, hookah, e-cigarettes and vape devices, nicotine pouches like Zen, heated tobacco products like IQOS, and disposable flavored and smart vapes that are heavily marketed through social media and digital platforms. Marketing has evolved from traditional advertising to influencer culture, lifestyle branding, and products designed to appeal to youth and young adults through flavors, sleek technology, and perceptions of reduced harm. This constant evolution is why tobacco control must continue evolving as well. Public health efforts must remain flexible and responsive through updated policy, surveillance, prevention messaging, cessation support, and health systems approaches that can keep pace with the rapidly changing nicotine landscape. Over the past 30 years, progress in tobacco control has come from comprehensive, coordinated strategies working together across public health, healthcare policy, and communities. Comprehensive tobacco control programs created the foundation for prevention and cessation efforts nationwide. Policy and environmental changes like smoke-free laws and tobacco regulations help shift social norms and reduce exposure to tobacco use. Media campaigns such as Tips from Former Smokers and The Real Cost increased awareness, prevented youth initiation, and encouraged quit attempts, while price increases and tobacco taxes proved highly effective in reducing use, especially among youth. At the same time, expanded quitline access, insurance coverage, and evidence-based treatment made quitting more accessible, and strong community partnerships helped sustain these efforts at the local level. Together, these strategies created lasting culture change and significantly reduced tobacco use across the country. As we look ahead, the next chapter of tobacco control will require adaptable, collaborative leadership that can respond to a rapidly changing landscape. Today's challenges also create opportunities for innovation. Rural access barriers highlight the need for stronger telehealth and community-based cessation support, while rising youth nicotine use calls for prevention strategies that can keep pace with the social media and emerging products. There's also growing recognition of the connection between tobacco use, behavioral health, and chronic disease, creating opportunities to better integrate cessation into mental health, substance use, cancer, cardiovascular disease, and diabetes programs. And I am actually spearheading these chronic disease integration programs at the national level, so very, very exciting work. At the same time, the tobacco industry continues to evolve through aggressive lobbying new product strategies, and efforts to weaken public health protections. The recent elimination of the CDC Office on Smoking and Health and ongoing policy challenges across states underscore the need for continued vigilance and strong public health leadership. Funding instability, misinformation, evolving nicotine products, and uneven policy adoption reminds us that tobacco control cannot remain static. The past 30 years have shown what is possible. The next generation now has the opportunity to build stronger, more sustainable approaches to prevention and control. As we think about South Carolina's next chapter in tobacco control, the opportunity ahead is not to just sustain progress, but to reimagine how we protect the next generation. That means strengthening prevention efforts among youth and young adults, expanding healthcare system integration so that cessation becomes a standard of care, and leveraging data and evaluation to guide smarter, more responsive strategies. It also means continuing to support local communities, particularly rural communities, because lasting change happens when statewide efforts are paired with local leadership and trusted partnerships. Most importantly, the future of tobacco control depends on building and empowering the next generation of leaders who can navigate emerging products, changing policy environments, and new public health challenges. The conference theme reminds us that tobacco control is not just about reflecting on the past 30 years. It's about preparing for the next 30 and ensuring the field continues to evolve to meet the moment. The progress we've seen over the past 30 years was not accidental. It was built through persistence, strong partnerships, evidence-based policy, scientific leadership, and the dedication of communities, advocates, healthcare providers, educators, and public health professionals across South Carolina and the nation. Every smoke-free policy, every quit attempt supported, every young person who never started, and every system change reflects decades of collected effort and commitment. And while we've made tremendous progress, the next chapter of tobacco control in South Carolina is still being written. The challenges are evolving, but so are the opportunities, the partnerships, the next generation of leaders ready to continue this work. Thank you, thank you, thank you to the longtime warriors and champions who have dedicated their blood, sweat, and tears to bring us where we are today in moving this field forward. And I see all y'all's faces out here. And to the next generation of leaders who will carry this work into our future. Thank you very much.